Hi everyone! Today we'll be talking about the top 5 common health issues about cats with Dr. Amber. We'll get a deeper meaning of each situation and how to prevent it. So let's get started. We're here to talk about pets, pet nutrition, and wellness, anything that can help our fur children live a longer, vibrant, and happier lives.
All right.
Yeah. Welcome to Vital Pet
Vital
Life
Pet Life.
Podcast. This is Donnie, your chief treat lady.
And I'm Dr. Amber, your official veterinarian at Vital Pet Life.
Hi, Dr. Amber. How are you?
Hi, Donnie. Good. How are you?
We're good. I'm good. So I'm kind of excited to talk about the top 5 common health issues about cats because, it seems like there's specific issues that cat parents have to go through, and we gathered the 5 most asked, or at the same time, what you can really find. A lot of people talk about it, which is kind of interesting.
I think probably, people probably know a little bit more about dogs, and all of these things are very different in cats than in dogs. And so I'm excited to talk about this too.
Yeah. So let's begin. Okay, number 1. So dental diseases. So I assume it's gonna be hard. Well, other than how do you clean your cats? I can easily clean my dog's mouth by forcing him
Yeah.
to come.
Yeah, I mean, it's sort of the same thing, brushing from a young age. You train them to allow you to brush their teeth. That's probably the most effective thing, and it's best done every day, which, when I with my dog, I did not brush his teeth every day, and it was hard. So, but ideally, if you can do it every day, that's the best. So you want to start young, of course, training them to do that. And then there's a few options for prescription diets that they're specifically made for dental disease. So when we think about dental disease, in dogs, we tend to get a lot of tartar buildup. You can see that gross, crusty stuff, and then their gums get inflamed. Where cats, they tend to get inflammation in their gums, which is called gingivitis, without having tartar. Cats don't usually build up a lot of tartar. So that's a big difference between dogs and cats. So cats tend to get more of an inflammation in their gums. It can be like an immune reaction actually to the plaque. So plaque is the step before tartar. So plaque is we call it a sticky biofilm. It has millions of bacteria. And then it hardens into tartar. So that's the hard, crusty stuff that you see. But cats tend to react to the plaque as if almost like it's a foreign body, and their gums get really inflamed. So this can be genetic. It can also be viral. So some of the viral diseases that affect cats, like leukemia or FIV, which is the feline AIDS, calicivirus, herpes virus, these viruses can also lead to gingivitis. And also a condition called stomatitis, which is even more serious, and it affects more of the mouth. So it's just a very different process from, human dental disease and dog dental disease. So things that you want to watch for, obviously, pawing at the mouth, drooling, not eating well, a bad smell coming from the mouth. And these cats tend to be pretty painful. There's also something in cats called resorptive lesions, where it'll actually be a destruction of their enamel and the dentin, which is that layer right underneath the enamel. It's not like cavities like humans get, but it's actually we don't really know why they happen, but it's a specific destruction of the teeth, and they're really painful. Like, you can imagine a hole all the way through your tooth, and then the root is exposed. And so these cats with resorptive lesions, like when I've been examining them, you can just barely touch their teeth, and their teeth are chattering. Like, they're just so painful. So yeah, all of these things
Oh, poor
definitely
guys.
need to take him to the vet. Sometimes, with really good oral care, and if you extract the teeth with resorptive lesions, then you can treat that. Some cats will need all of their teeth extracted because it's almost like they're reacting to what's on their teeth as a foreign body. And so some of these cats don't, I mean, that would be an extreme case. We definitely don't, just yank out the cat's teeth for mild cases. But yeah, there have been some of my patients where we've extracted all of their teeth, and that's the only way that we got rid of the inflammation in their mouth.
Wow, that's crazy.
Yeah.
Wow. I'm still like I'm having a hard time cleaning Tuxie's teeth. Like he would never let me touch his teeth. Only Kyle
Mm-hmm.
can do it. But yeah, he gets like dental cleaning once a year. Do cats
Yep.
also get that? Oh, okay.
Yeah, I mean, I think they should. I think we don't. Well, and cats are really good at hiding it too. So I've
Mm.
seen some cats that come in with pretty severe disease, and the owner was like, she's still eating, she's not acting painful. But, you think like they don't have a choice. I mean, if they want to eat and drink and live, like they have to, I mean, their cats are pretty good at hiding it. And so, definitely at
Aren't
that.
they known for that? Like they're pretty good at hiding their
Yeah.
problems.
Yep.
Wow.
Yeah, I think dogs, I mean, some dogs are, but dogs tend to be more vocal animals, more
Mhm.
needy in some aspects, and cats are, just more aloof and more solitary and better at hiding. They're not gonna, like my dog, when he wanted something, he would thunk his big head right on my lap or on my chest.
Yeah, I got
Cats
someone
don't
like
tend to do
that.
that. They kind of isolate themselves when they don't feel well most of the time. And
Oh,
so, um, at that yearly visit with your vet, if you're getting vaccines and just your yearly health exam,
just make sure
the
to have
vet
it done.
should be, doing as good an exam as you can do on an awake cat sometimes. Um, but certainly dental cleanings, cats probably need them once a year too. So
Oh, mm. Well, there you go, guys. So the second disease, kidney. Okay, this is really tricky. Um,
yeah.
why?
Yeah. So I don't think that we've really pinned down the cause of kidney disease in cats, but it is really, really common in middle aged to older kitties. So signs that you're going to see are excessive drinking, and because of that, excessive peeing, poor appetite, weight loss, vomiting. They'll get really dehydrated, even though some, pet parents will say, well, they're drinking all the time. How can they be dehydrated?
Yeah.
But one of the kidney's main functions is to save water in the body. So when the
Mm,
kidneys can't do that, they're drinking a lot of water and they're just peeing it all out because the kidneys can't
oh,
save that water like they should. So those are the major signs that you'll see with kidney disease. And the kidneys are really interesting in that their cells, the nephrons, those are the units of the kidneys that do all the work. Cats have to lose like up to 60 to 75% of their kidney function before you can really see a lot of signs. There's a lot of
wow.
redundancy in the kidneys. And so it has to be pretty advanced before you start seeing some of these signs. So that's just to highlight like the importance of yearly blood work. If your
Mm,
cat seems fine, but your vet recommends a yearly blood work, you can pick that stuff up earlier by doing blood work than waiting for all of these signs to show up when they've already
mm,
lost more than half of their kidney function.
wow. Um,
Um, oh, go
yeah, I
ahead.
have a question. So,
Yeah.
does food too play a big part of that? Finding the right food that can like be not stressing the kidneys, or
Yeah.
I don't know.
Um, that's a good question. And I think there's not a perfect answer for that. But let me just say, I kind of wonder if feeding cats kibble all the time kind of puts them at a dehydrated state most of the time, if that makes sense, because
Yeah.
cats don't drink water like dogs do. They're just not designed that way. If you are feeding a cat only dry food, which is super convenient, it's easy, but I kind of wonder if they're like low grade dehydrated all the time. And obviously, dehydration can be
Really.
detrimental to the kidneys.
Mm-hmm.
So, if I had a cat, I would probably feed mostly wet food.
Mm.
Um,
What about fresh food? Like, there's a
yeah,
lot of like fresh food now out in the market for
yeah.
dogs. So probably it's the same, right? Or
Yeah, I think my this is a little a side tangent about picking food, but I tend to choose foods that have a long track record. They have a lot of scientific literature behind their products.
Mhm.
They have veterinary nutritionists on staff who are formulating their diets. If all of those requirements are met and it's a fresh food, I think that's probably fine. So diet is super important when you have a cat with kidney disease. I 100% recommend prescription kidney diet for cats and dogs, for that matter,
Mhm. Mhm.
with kidney disease, because I think, not only are they losing a lot of water, they get buildup of certain minerals, they get deficit of certain other minerals. The kidneys are the main organ that balance those things in the blood and the urine. And so when they can't do their job, they're going to end up with a lot of deficiencies in certain minerals, a lot of excess, like phosphorus. The
Yeah.
kidneys can't flush out phosphorus, so they tend to get high phosphorus. And
Mhm.
so kidney diets are specifically formulated for that. And I think that's the number one thing, the diet, the number one thing to do to treat kidney disease is to put them
Yeah.
on a prescription diet. There are some medications that you can use to treat secondary problems, like cats with kidney disease tend to get high blood pressure. So you can
Oh.
treat, with medications to bring that blood pressure down. Um, Certainly, there's a lot of evidence that fish oil can help the kidneys, just decrease inflammation in the kidneys and slow the progression of the disease. Unfortunately,
Mhm.
kidney disease is progressive. So
Mhm.
whether it's, progressing in a month or a year or a few years, I think, you can slow that progression with diet and fish oils. I think those are kind of the highlights of kidney disease in cats.
Wow, yeah. But I think the next one kind of wrap around diet because it's diabetes. Like I didn't even know how cats will get. I mean, how do they get diabetes? Like, are they
Yeah.
eating sugar? Like,
Yeah, I
or
know
carbs? Like, oh my
that's
god.
kind of weird to think about, but
Yeah.
so cats most of the time are type 2 diabetics. So it's super common. It's very common in cats that are obese. So you'll
Oh,
see these big fat cats, they get type 2 diabetes.
Siamese.
So they
Yeah.
have enough insulin, they're just
Mm-hmm.
resistant to it. And so, but it works the same way in type 1 diabetes, which dogs tend to get. They don't have enough insulin. And so the main job of insulin is to take the glucose from the blood and put it into the cells to use for energy. So when there's not enough insulin, the cells aren't getting the energy they need. In type 2, there's enough insulin, but the
The
animal
body.
is resistant to it. The body, yeah, same in type 2 diabetes in humans.
Mm-hmm.
There's enough, but the body can't use it effectively. So you actually get usually higher levels than normal of insulin, but it can't do its job to put that glucose into the cells to use for energy. And so, in some type 2 diabetic cats, if you put them on, you get them to lose weight. Most of them, we will start insulin injections, but if you can get them
Wow.
on a good diet, they tend to do well on high protein, low carb diets. You put them on insulin. I've actually been able to get a few cats off of insulin eventually. You kind of slowly taper them back as their blood glucose normalizes with the weight loss and the diet, but not always. I mean, sometimes they can basically, what can happen is that they're kicking out so much insulin, but they're getting these buildups of, they're called amyloids. They're basically like these kind of protein deposits that destroy their pancreas. And so over time, they can actually convert to type 1 diabetics. So their pancreas just kind of shuts down. They don't, and so they can't produce insulin. So not all cats, you can't get all cats off of insulin eventually, even with diet and weight loss. But I have been able to get a few kitties off of insulin. So real quick, the signs that you're going to see with diabetes, they're going to drink a lot. They're going to pee a lot. A lot of people will notice their urine is sticky because when they go and they pee in the litter box and they come out and they've got the litter stuck to their paws. And so because their glucose levels are so high in the blood that it's just spilling out into their urine. So their urine will be sticky. So if they pee on the floor, you'll like notice this really sticky patch of urine, or the litter will get stuck to their paws. Yeah. So those are big signs to watch for.
I mean, it's kind of like I'm thinking about like weight loss and cats. Like, I mean, easily with dogs, right? We can look, I mean, the intake, but again, the amount of activity, you can always take them out on a hike, like run, whatever, and a play. But it's kind of hard for cats. Like, it still bothers me when I see some, I mean, I don't want to judge the cat owners, but I've seen some cat owners putting their cats on leashes sometimes, but I'm like, oh, why? But it's just maybe I'm not used to that. If I find it,
Yeah, so that's a good question. Much easier to get dogs to exercise than it is for cats. And so there's a couple of things that I recommend. I think cats, you notice they tend to like to get up to higher places. So they'll jump up on the counter, they'll jump up on top of the cupboards. So provide a cat tree and put their food at the top. So they have to jump up to get to their food. Laser pointers. I've even had some clients like put a cardboard box over the food bowl and cut a little hole. So the cats actually have to reach in to like pull the kibble out. And it's not burning many calories, but it's a little bit of exercise. The other thing, I think they're called Doc and Phoebes. They're really cool. These cool little feeders. They're actually shaped like mice, and you fill them. And I think it comes with like 3 or 5 in a box. And so you can hide them around your house. And so that like will get them exercise. It kind of feeds their natural hunting instinct to feed them this way so that they're hunting for their food. And it's also portion control. The other thing is maybe if they spend most of their time in this room down the hallway, feed them on the other side of the house. And so they have to, physically, like they just have to go a farther distance to get to their food. One thing to be cautious about in cats, especially when they're obese, is you don't want them to lose weight too fast. You want to just really be slow about their weight loss. I mean, you would think, gosh, we got to get all this weight off of them. But cats can get a condition called hepatic lipidosis. So I've seen it a lot in fat cats who lose a lot of weight really quickly. The body's breaking down that fat so quickly that it actually kind of gets clogged up in the liver and causes a form of liver failure. Hepatic lipidosis is very serious. And so, again, we want these kitties to lose weight, but we don't want it to happen too quickly.
Yeah, I think it's also important to have like a vet to discuss the weight loss and, to really have a plan, I think.
Yep. Yeah. Talk to your veterinarian, have them come up with a diet plan, weight loss, so that we do it at an appropriate rate.
Wow. Well, oh my gosh, it scares me because I don't know if I can.
Just don't let your kitty get overweight in the first place.
I know.
Yeah.
Too much of those like goos. Like I've seen all those like little cutie goo that you can give the
Oh yeah.
Yeah. Snacking.
Yeah.
Okay, so the next one is hyperthyroidism. I didn't even know that they get that.
Yeah. So cats will get hyperthyroidism, which is an increase in thyroid hormone. Dogs get hypothyroidism. So that's low thyroid disease. So humans actually get both, but
Mm-hmm.
it's almost always, cats get hyper and dogs get hypo. So hyperthyroidism happens because they get a nodule on their thyroid gland that's producing too much thyroid hormone. So in these cats, like when I do an exam on them, I can actually feel their thyroid sometimes. Like in a normal cat, you shouldn't be able to feel their thyroid, and it's on either side of their trachea,
Mm-hmm.
the windpipe.
Mm-hmm.
Um, but you feel a nodule there, and that's abnormal.
Mm-hmm.
So what happens, because the thyroid hormone, it has a lot of different functions, but one of the main functions is to control metabolism. So when you have too much, they'll lose weight, but they're eating a lot. Like they're always
Mm-hmm.
hungry. They're eating, but because their metabolism is so high, they can't even keep up with that. And so they're losing weight. These cats will vomit. They'll also drink a lot and pee a
Wow.
lot. So you're seeing that a lot: kidney disease, diabetes, hyperthyroidism in cats, three common diseases that all cause excessive drinking, and excessive peeing.
Excessive peeing and
Um,
also eating, I guess.
Yes,
That's
and
how, that's
excessive
what, yeah.
eating. Yeah.
Yeah.
With kidney disease, they usually have a poor appetite. They won't feel, they just feel
Full.
cruddy overall, so they don't want to eat. But usually with diabetes and hyperthyroidism, they'll have an increased appetite, but they're still
Wow.
losing weight because they're not, diabetes, they're not
Sorry.
able to use the energy that they're taking in. And hyperthyroidism, they're just burning off everything that they take in. They'll vomit, and they'll have, sometimes they act more hyper. It kind of like makes them a little crazy because they've got so much thyroid hormone going on.
Oh.
So again, I've said this before, but blood work, yearly blood work, will easily pick up kidney disease, diabetes, hyperthyroidism.
Yeah.
Um, that should be three things we're screening for in every middle age to older cat every year.
Wow.
So thyroid disease, hyperthyroidism, kind of the gold standard of treatment is
Mm-hmm.
called I-131 therapy. And so it's actually a radioactive iodine that's
Mm-hmm.
injected, and it goes to that abnormal nodule. It doesn't kill normal thyroid tissue, but it goes to that abnormal tissue and it kills it so that they're not going to produce excess thyroid hormone. Now, in my years of practice, I
Mm-hmm.
had exactly uh, zero clients choose to do that. It's
Oh.
very expensive, and there's only certain
Oh.
clinics that do it, because obviously you're giving them radiation. It needs to
Mm-hmm.
be really controlled. They need to be hospitalized for a certain amount of
Yeah.
time. Usually, one treatment is effective, but some
Mm-hmm.
cats will need more than one. And
Mm-hmm.
so most of the time it's just cost prohibitive to do that.
Yeah. Yeah.
Surgery is tricky because you have the parathyroid hormone there too. And so we don't
Mm-hmm.
normally recommend surgery to remove those nodules. And they're not necessarily like cancerous nodules,
Mm-hmm.
but they're just producing excess thyroid hormone. So the main treatment that my clients chose was a medical treatment. So it doesn't get rid of the thyroid nodule, but it
What's more
decreases
of,
the thyroid hormone production. Yeah,
yeah,
so it
so it's
blocks the
more on
production
like,
to keep, bring those back, the thyroid hormone levels back down into normal, and
mm-hmm.
normalize the signs. So they're going to, put some weight back on. They're going to stop vomiting. They're going to drink an appropriate amount of water and stop peeing everywhere. So the
So
medical
it's,
treatment is the major one that we use.
yeah, so it's more like maintaining or just like pretty much like, that's how you mitigate it, not to
Yeah.
like
Yeah. Like
yeah.
you're not curing it. They'll have to be on that medication forever.
Wow.
But you're definitely improving their quality of life. You're making them feel a lot better and making it so they're not drinking a ton and peeing a ton. The other thing, hyperthyroidism, it can cause, it can affect their heart, their blood pressure gets really high. And so we're just decreasing all of those secondary things that come along with it too.
Yeah. Well, I have a neighbor that has a cat that has hyperthyroidism, and I think she goes through radiation. So the
Oh
cat
yeah.
has, yeah. And then I remember she's telling me like, oh, we had to put her in a certain like area because like the radiation like for like two
Yeah.
days
Yep.
just to like.
Yep. And that's why a lot of people are like, I'm not willing to do that,
It takes a
to,
lot of work. Yeah.
yeah, it is expensive and they have to stay in the hospital for a few days and wait for the radiation to get out of their body. And it's not always effective on the first time. So then sometimes you have to go through it again.
Second time.
Yeah.
Yeah. Oh my God. Okay, last one. It's called Feline Immunodeficiency virus. What is that like?
Yes.
Is it
Yeah.
like HIV?
So it is. We call it
Oh,
kitty
really?
AIDS. Yeah.
No.
It's the feline form. Just
Wow.
to clear it
I
up,
thought it
like
was.
human.
I was just joking, but
Nope.
okay.
That's you're right. But just know humans are not affected by FIV. It only affects cats. I'm going to just add another one on here too, feline leukemia virus. So these are, two more common viruses that we see in cats. So FIV, it's transmitted through bodily fluids. So mostly like saliva and blood, like fighting cats. So
Oh,
intact male roaming cats who fight with other cats are more
prone.
susceptible to it.
Oh.
Just higher risk group. So it does cause immunodeficiency, so poor immune system. So these cats tend to get more infections of all kinds. They have a harder time fighting it off. And so usually if they do get an infection, you want to catch it earlier, you want to treat it longer. And then feline leukemia virus is passed through saliva. It can be like shared water bowls, grooming.
Oh.
So we kind of call like FIV like the fighting, the angry cat disease. And FELV is like the nice cat disease because you can just pass it through saliva. It doesn't have to be bites and
Oh.
scratches. And so outdoor cats, just because they tend to fight and have more contact with just street cats, those cats are more prone to FIV and FELV. So FIV, there is a vaccine. I've never ever given it in my career. I think it's just not very effective. And so I never recommended it. FELV, on the other hand, does have a very effective vaccine. And so what I normally recommend is that the cats get vaccinated for FELV as kittens. They go through the kitten series. Because they tend to produce a stronger immunity as kittens. And then if they're going to be indoor outdoor kitties, continue vaccinating them, boosting them every year. If they're going to be indoor only kitties, then they're at lower risk. So if they're indoor only, they don't have any contact with any other cats, then I don't think you necessarily need to continue to vaccinate them for FELV. But I still think it's a good idea for pretty much every kitten.
To have it.
Yeah, there is a blood test, pretty simple test. You just take a few drops of blood, a test that will look for both FIV and FELV. It's a bedside test. So, any full service clinic will have them. And even in our vaccine clinics, we have the FELV, FIV tests. It can be scary to get this type of diagnosis, but and it can for sure shorten their lives. FELV can cause certain types of cancer, also anemia. It can cause immunodeficiency too. But I think these cats can also live long, healthy lives. It can shorten their lifespan for sure, but I don't think it's a death sentence. So I've never just diagnosed these cats and say, oh, we have to euthanize. I think that if we take good care of them, we keep them indoors, first of all, so that they're not passing it on to other cats. We give them good nutrition. We treat them early for any type of infection. Then I think that they can live a pretty good, healthy life with these diseases. So
Yeah, I think it goes for all the diseases, I guess, and it both ways for, and I think being able to, again, like, talk to your vets, like, really, if you don't feel like, you got your answer from one vet, get another opinion, just
Right.
like how we do it
Yeah.
with humans.
Yeah.
Yeah.
And normally, even, we can sometimes have false positive tests too. So if we had like an FIV or an FELV positive test, I would always recommend there's some more in-depth testing that you can do to
Mm-hmm.
really confirm whether or not they have that. So again,
Mm-hmm.
talk to your vet. Don't automatically think that, oh,
That's
this
the
is the
last
end.
thing.
It
Yeah.
like I said, it can be scary, but do some further testing. And some of these cats will live a long, healthy life even with these
Yeah,
diseases.
I bet. Yeah. But wow, these are really new things that I'm learning from you, Dr. Amber. And yeah, I hope that, our cat parents out there that are listening will learn something from this conversation.
Yeah, I hope so too.
Yeah. So I think my takeaway, to be honest, pretty much like have a routine, like physical exam for these guys. And,
Yes.
I think the routine one is always, does that really, I mean, it also involve like blood work, and
Yeah,
yeah.
absolutely. Yeah. I mean, I've met a lot of pet parents, who, oh, my cat's healthy. He's never been to the vet. He's fine. And which, on one hand, if he hasn't shown any signs, that's good. If he seems to be happy and healthy at home. But
Mm-hmm.
also, some of these diseases, like it can be pretty advanced before
Mm-hmm.
you diagnose them, and then it's much
Mm-hmm.
harder to treat, and then
Mm-hmm.
more expensive and all of that. And so
Mm-hmm.
I would just really encourage, if you're taking your dog to the vet every year, your cat needs that too. So
Yeah, I think for everything too, for even human, like prevention is always key.
absolutely. Yeah.
Yeah. Well, thank you, Dr. Amber.
Yeah, thank you, Johnny.
Yeah, conversation. Don't forget to follow our channel for more talks about pets, tips, advice, and fun stuff.
Happiness, vibrance, and longevity for our fur babies and our planet.
Thank you for tuning in, our dear fur parents. This is Donnie, your chief treat lady at Vital Pet Life.
And this is Dr. Amber, your official veterinarian at Vital Pet Life. Have a possum day until next time.
Yay!
We did it.
Yeah, I heard about, like, I mean, they have 7 lives, right? They always, is that a
9 lives.
9 lives or whatever?
Yeah. Yeah,
Yeah.
cats are amazing. I mean, they can get themselves into some pretty tricky situations, and you're like, how did this cat survive? I have no idea, but here they are.